back to winning isn't easy. Does your long-term disability carrier or plan expect that you undergo the mild procedure for spinal stenosis? The lumbar spinal stenosis, known as LSS, is a spinal narrowing and compression of the uh, spinal cord nerves in your spine. Now, the word stenosis is Greek and it means narrowing, and that is exactly what happens. Your spinal cord and nerves are surrounded by bones known as the vertebrae and ligaments, which are the dense bands of connective tissue that connect bones to other bones to form a joint. In a normal spine, the spinal canal is wide enough to accommodate the spinal cord nerves. But what happens if you have a spinal injury, a tumor, or an injury to the ligaments, or a herniated disc, or even osteoarthritis? What happens is that the bones and ligaments can be damaged, and as a result, they can be a narrowing of the spinal canal. That narrowing can put pressure on the cord and the nerves that will send electrical signals both to your arms and to your legs. Now, as a result, you might have back pain or tingling into your lower extremities with numbness and weakness that make it difficult for you to walk, stand, or sit. The pain, tingling, and numbness can make it difficult, if not impossible, to work. Similarly, you can have the same symptoms in your upper extremities, but obviously it would impact your fingers. You might have tingling and numbness in your fingers. You might have difficulty picking up things, buttoning buttons, those sorts of things. Now, as this condition progresses, because it is a progressive condition, you want to make sure before you stop work and apply for benefits that you're doing a couple things. First is to get your disability policy or plan out and read it cover to cover so you understand what it is you need to prove. You also need to understand whether there are policy limitations, such as subjective medical condition limitations, that will limit the benefits to just 2 years. But you also have to understand your affirmative obligation as the policyholder or plan beneficiary to get appropriate medical treatment. Many policies or plans will say that you are required to get reasonable and appropriate medical care. So what is reasonable and appropriate medical care in a stenosis case? The treatment options for spinal stenosis are things that the disability carrier are going to look for to see what's been recommended and to see what your response was, because they're going to have their life for hire peer-reviewed doctors look at the medical records and evaluate just that. So what are they looking for? Well, they're looking for treatment options such as a laminectomy, which is a common spinal procedure that removes a portion of the vertebral body known as the lamina. There's a laminotomy, which is spinal decompression surgery where only a small part of the lamina is removed. There's disc replacement surgery where the disc is replaced with an artificial disc, and there's a decompression of the cord and nerves while they're preserving motion in the disc space. There's a lumbar or cervical fusion where the damaged disc is removed from the lumbar or cervical spine and the vertebrae are fused together using rods and clamps. There's something called a radio frequency ablation, RFA, that uses high energy radio frequency to remove or vaporize the damaged nerves, eliminating the sensation of pain. Now, except for the RFA, all of the procedures that I just mentioned involve extensive surgery and a protracted recovery. During this disability period, carriers are going to face an exposure for paying you benefits while you're recovering from the surgery. They're not necessarily in the business of paying benefits, and they're going to be looking for alternative forms of treatment that may enhance the recovery period, or are alternatives to a more invasive procedure. One of the procedures is called the mild procedure, MILD. It's primarily performed by pain management providers. And if your doctor determines that your pain is caused by ligamentous issues, you just may see the mild procedure being recommended, notwithstanding the fact that the issue can be caused by the stenosis. So what is the mild procedure? It's an outpatient procedure performed through a tiny incision in your back. It doesn't require any general anesthesia. It's made in your back and specialized tools are inserted through the incision that allows for removal of small pieces of bone and excess ligaments that are causing the narrowing of the canal. Now, the purpose of this procedure is to restore the space in the spinal canal and relieve the compression of the nerves, which in turn reduces the pain and restores mobility. This is done under fluoroscopy. This is a procedure that's been approved by the FDA, so it's a recognized treatment. In any event, the disability carrier really can't make you undergo invasive treatment. And because this is sort of minimally invasive in the range of treatment options I just discussed, the disability carrier may be unhappy with the length of time your recovery is taking place. And they may even go so far as to suggest to your doctor that the doctor should consider alternative methods of treatment, or even recommend to you that there are other treatments that you might avail yourself of that would reduce your period of disability. Now, they're not going to say that quite that way, but they will certainly question the length of time it's taking for you to recover, and they'll use medical duration guidelines to sort of say, well, you should have been recovered by then. Now, you isn't everyone, and everyone isn't you, okay? What I mean by that is that disability carriers sometimes have a nasty habit of not looking at you as an individual and your recovery period or process, and apply these uniform guidelines to these types of cases. In any event, you should be considering all of your treatment options, because at the end of the day, you want to make the best recovery possible. If you have any questions about your rights to your ERISA long-term disability benefits, particularly if you've got an issue with stenosis or other spinal conditions, you should be consulting with an experienced ERISA disability attorney who can help you plot your way through the terms of the policy and your treatment options. Got it? Let's take a break for a moment.